To medical news now. There are more than 55 million cases of dementia worldwide, and that number is expected to triple by 2050. A new study in The Lancet has identified 14 risk factors, also ways to delay and even prevent dementia. CTV News medical specialist Dr. Marla Shapiro joins us now to talk more about this. Doctor, thank you as always for joining us. What are the new risk factors? What are we looking for?
So it's very interesting because many of them are things that accumulate over time, but some of them start early in childhood. So we've listed them for you so we can go through the types of things that we see, and the things that you see bolded are the things that are particular importance. So as we go through that list, you'll see one of the first things that is on that list is high cholesterol, then vision or hearing loss, less education. So that's an early childhood exposure that speaks to things like policy. That's really important. Things like head injuries, physical inactivity, and we're going to talk about why physical inactivity is so important. Smoking, not a surprise. Excessive alcohol consumption is on that list as well. So you can see that many of these are preventable. Hypertension, our medical way of saying high blood pressure. Obesity, so beyond overweight, but reaching that BMI category where we're concerned. High blood sugar, our diabetes, also a particular concern. And then depression, so mood. Air pollution, that's also very interesting, and infrequent social contact, which we've highlighted as well, because these are some of the newer ones that have been added to the pre-existing list of what we knew were risk factors.
And it's so important because for many of these things, there's simple solutions to them, really.
Simple screening, simple solutions, and if you look at the overall global 14, you can reduce dementia somewhere between 40 to 45%, with each of these factors weighing in a little bit differently. So if you look at the prevention list, it's not a surprise that we then take that prevention list and put it into an action list. So quality education, that speaks to policymakers early in childhood, making sure that our children are educated. Avoiding cigarette smoke, that's really important, and smoking cessation, it's never too late. Understanding that safe upper limit of what alcohol consumption is, we always debate about that, but clearly excessive alcohol consumption is something that you should avoid. It really is a toxin for the brain. If we look at cognitive stimulating activities, so that doesn't just mean using your brain, but challenge your brain to do something that's more difficult, that really gets those neurons connected, using head protection. So if you're cycling, all the way from childhood, skiing, any of those contact sports. Exercising is really interesting because we think of what's good for the heart is good for the brain, but when it comes to exercise, overactive in terms of great for the heart and muscles, moderate activity for the brain is great because it increases something called BDNF, which is very important for our plasticity in our brain. That means our neurons learning how to move and how to connect with each other and adapting to change. Maintaining a healthy weight, clearly important. Treating obesity, preventing diabetes. Excessive sugar actually starves the brain because the brain will turn itself off if it sees too much sugar. Understanding what your blood pressure is and getting it to target. Getting your cholesterol in line, knowing what your risk factors are for cholesterol and what your numbers should be, and really making sure that your mood is being looked at, that you're socially connected, your hearing is being screened for, your vision is being screened for, because hearing, many people are surprised, is a big link to dementia, and really something, really interesting that much of dementia. And then air pollution and HEPA filters and avoiding wood or, those types of burning stoves because of the pollutants. But one of the things also for midlife and beyond is that social connectedness is so important, that social isolation. So many actionable items here that have been identified.
Well, and study after study, those blue zones, right? And one of the big things is the social interaction because it gets you out as well. You exercise, you walk, and you see friends.
And we saw during COVID how difficult this was and how important it was to have social connectedness, even not in person at that point, and hopefully we never go back to those days. But really, the social isolation was one of the most critical things we saw during that period of time. And understanding that your diet and blood sugar and exercise, that you really can increase the way your neurons connect with each other, can be active, more mobile, and more reactive and more spontaneous. So it's really important to adapt that healthy lifestyle, and it has a never too late message here. You can change your smoking, you can change your alcohol, you can make sure your vision and hearing is good, get screened for your blood pressure and so on. What's good for your heart, good for your brain, good for all of us.
But how do you not get overwhelmed by that list? Because I was looking at it going, oh.
Yeah.
How do you, can you pick and choose where to start on that list?
Well, in terms of a routine examination, being screened for your blood pressure, your cholesterol, your diabetes, your weight, all of that, is one fell swoop. Your hearing and your vision, you've just knocked off 7 things on that list. Looking at your lifestyle in terms of keeping your exercise and activity, looking at your brain, looking at your alcohol, looking at your smoking. Although it seems like a lot, it actually is more of a healthy lifestyle that will incorporate many of these things that we're talking about.
And now also these indicators are for 40% of people with dementia.
Can reduce 40%, up to 40 to 50% of dementia is thought if you address these 14 factors. Look, some dementia is based on genetics, it's based on other vascular causes, or many different types of dementia. Dementia is a broad, name, but there's different types of dementia. So can't prevent all of it, but 40% is a pretty good number to start with.
All right. Doctor, thank you as always for joining us. CTV News medical specialist, Dr. Marla Shapiro.